In the heart of Masaka City, welcome to Maogola Pharmacy, your number one pharmacy in Masaka City, ekibuga kya Ssaabasajja Kabaka. At Maogola Pharmacy, you feel the professional touch by a team of dedicated staffs that serve with empathy, love and care. Find us opposite UTHUMAN offices or call us on 0745 976965 or 0784 986138 for orders and deliveries.
When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Pharmacy, we serve with care. When you are sick, you need a good ambience to pick your medicines. Maogola Pharmacy is here for you. Has human medicines for both retail and wholesale. Found in Sembabule and Chigangazi Town Council. Call us on 0200 908 184 Sembabule or 0700 577 241 Chigangazi. At Maogola Pharmacy, we serve with care.
Welcome to Bikoff Medical Center, located in Masaka City and Sembabule Town Council. We have a dedicated team of health professionals ready to serve with love and care. We offer a wide range of services: a diagnostic laboratory, ultrasound scan, dental services, maternity and surgical services, physiotherapy, For more information, call us on 0759 54 1708 Masaka and 0759 54 1703 Sembabule. Bikoff Medical Center, we treat good health.
Good evening, my viewers. Welcome to Ask Dr. UTHUMAN YouTube channel and TikTok channel. As usual, I have always told you that we answer medical related questions. That is to say, we answer questions regarding reproductive health. In other words, most times some of you come and ask questions which are concerning other areas. You tell me about children issues and so on. But what I'm interested in, all the area where I understand most is reproductive health. Asking me questions concerning fertility, etc. Those are the things I understand most. So I expect questions to be running around that area. To 2, if you'd like to get in touch with me to have a private chat, go to my website and book an appointment. That's when you can have a private chat, because I know some of you can't put questions straight here. You fear, the privacy, confidentiality, and so on. So if you don't want to share your question in public, then you can go to the website, that is www.druthman.com, and book an appointment. We can have a one-on-one chat. So welcome to our live today, and we are strictly going to use only 45 minutes. So by, I think we are going to use 40 minutes. So by exactly 8 p.m. or 20 hours East African time, we shall be done. So please start asking your questions so that I can answer them. And right away, we shall start with question number 1. Franklin Obese, hello, good evening to you. All of you are still greeting me. Good evening to you. All right, now this is the first question. It says, Blessing Ebiri is saying, if they any sign that pregnant woman will know that the gender of her baby with going for a scan. No, I think he is asking about whether there are signs a pregnant woman can look at, and then they get to know that probably they are carrying a female gender or they are carrying a male gender. So now, there are many signs, people. I think when you go to the internet, there are a lot of things people have put there. They have put a lot of signs and symptoms and so on here, how you can know that this is a boy, this is a girl, and so on. However, all those ones, it's just guesswork, okay? It's just guesswork. There are no clear signs, okay? There are no clear signs that you can look at. Scientifically, we don't have those clear signs that you can look at and get to know that you are carrying a baby boy or a baby girl. So scientifically, if you want to know the gender you are carrying, then you are supposed to go there to go and do an ultrasound scan. When you do an ultrasound scan, it's able to show you exactly the baby you are carrying. So it's the absolute, what can show you the gender of your baby is an ultrasound scan. Okay, so I think that one is also very, very clear. So we have another question. This one is called the Mulikat Tijani is saying, have been trying to conceive but not coming. My menstrual cycle is 33 to 35 days. Please, your assistance is needed. I've been trying to conceive but not coming. My menstrual cycle is 33 to 35 days. Please, I need your assistance. Now, first of all, if you've been trying to conceive and you're failing to conceive, there are very many factors. I've already said that for someone to conceive, a lot of factors have to come into play. A lot of factors, okay? We have issues to do with hormones. We have issues to do with the structure, okay? So if you look at when someone fails to conceive, we have to look at many things. You have to look at the vagina. What is in the vagina that is stopping someone to conceive, okay? For example, there are some women that have, because the vagina is supposed to be acidic in nature, and that acidity of the vagina facilitates the well-being of the sperms once deposited there. So you may find that the woman has an alkaline vagina, and it's not acidic. So that, of course, will not facilitate conception. So that can be a factor. 2, someone may be having a mass or a swelling in the vagina, or if what we call, some people have an imperforated vagina and so on. So if the vagina has a problem, of course the woman will not be able to conceive. Now when from the vagina we go to the cervix. If the cervix is blocked, the woman will not be able to conceive. If the cervix has a mass, if the cervix, for example, women with cervicitis, the cervix is inflamed, it would also be very hard for a woman to conceive. Now we got the uterus. If the uterus has masses, if the uterus has masses like fibroids, women who have fibroids, of course, most of them will find it very, very hard, very difficult for them to conceive. So if there is a fibroid, we will not have problems. If there are scars in the uterus, of course, we shall have problems with conceiving. Then further, we go to the fallopian tubes. If fallopian tubes have a problem, for example, fallopian tubes are blocked, blocked fallopian tubes, you have a PID, a severe PID, you have masses attaching, or masses that have attacked the fallopian tube, for example, the ovarian cysts, or those ovarian masses, the complexes and simple ones, of course, will not be able to conceive. Then from there, we go to the ovaries. If ovaries are affected, if you may find a woman that doesn't have ovaries, you may find that the ovary has masses, someone has arthritis, of course, that will affect the fertility of this woman. 3, 4, we go to the eggs themselves. After the ovary, we go to the eggs. You may find that the woman doesn't have eggs. There are not enough eggs, okay? You may find that the eggs are there, but they are not functional, okay? They are not functional, or they are sick. So that will also stop a woman from conceiving. That is when we are looking at the structure, how a woman conceives. Now, apart from that, we also have, of course, if you look at those structures, what we've seen, the uterus, the cervix, the fallopian tube, the vagina, and so on, they are controlled by hormones, i.e., follicle-stimulating hormone, that is FSH, luteinizing hormone, that is LH, estrogen and progesterone. Of course, other hormones, the prolactin, it is many hormones control these processes. Now, if these hormones have a problem, for example, you have hormonal imbalance, you have low levels of progesterone, you have high levels of prolactin, you'll have issues with conception. So now, it's broad. When a woman fails to conceive, we don't look at just one factor, because for you looking at, she's menstruating, but I'm menstruating, but I'm not able to conceive. There are a lot of things. Many women are infertile, yet they are menstruating. So we have to look at many factors to rule them out and confirm what is stopping you from conceiving. And when you get treatment, definitely you'll conceive. Another question here is coming from Chia. Is saying, I have a question, doctor. If I want to pregnant with twins, that my cis have twin, which pill is best for me to take, letrozole or clomid? I have polycystic ovarian syndrome with the glucophage of 80/50. Now, you use letrozole. Letrozole is stronger than clomid. Yeah, you use letrozole. I think that one I'm done if you want twins and so on. Then we have Irene Peachy. Irene Chipinyi is saying, do you unblock tubes? Do you unblock blocked tubes? Yes, they can be unblocked. Chia, please answer. I've answered you. Okay. Florence Wanjiko, I have been having menstruation for 5 days for the last 2 months. What can be the problem, doctor? 5 days is okay. 5 days is okay. Yeah, 5 days is okay. Normal menstruation ranges from 2 days to 70 days. And some people go up to 8 days. So except if you go above 8 days, that's when we call it abnormal. But 5 days is very normal. So that shouldn't be a big issue. Yeah, they might have changed. Maybe you've been having 3 days, 4 days, and right now you've reached 5 days, but it is still normal. There can be some hormonal fluctuations that can cause elongation of periods, but still bleeding, having menses for 5 days is normal, and you shouldn't worry about that. Then we have another question from Teresa Sambu. Is saying, Teresa from Kenya, I have used the pills for 7 years now. How long will it take me to conceive after stopping? Now, it varies, you know. First of all, you're doing something wrong. You are not supposed to use family planning pills for a period of 7 years. Please take this. Family planning pills are a short-term method of family planning. Short-term methods of family planning do not go beyond 3 months. Okay? So if you can't use pills for 7 years. That is wrong. So you're already doing a mistake. But now let's assume that you used the pills rightly. Even if you've used the pills rightly, sometimes you can take a little bit long to return to fertility. Some women can return to fertility immediately. Others will spend a month, others will go to 3 months, maximum 6 months. Once it goes beyond 6 months, then there is a problem. You have to investigate and get a solution. We have another one. It's called Maxwell Fokwa. He's saying, Doc, my girl always crying of menstrual cramp. What is the solution? Menstrual cramps or periodic pain is what we call dysmenorrhea. Dysmenorrhea. It's very common with ladies. You find a woman every month they are going to have their periods. It's a war. They're having a lot of pains. A lot of pains, severe pains. That is a very big issue, and it is called dysmenorrhea. Now, this issue of periodic pain, someone with periodic pain or dysmenorrhea, is characterized, is grouped into two. We have what we call primary dysmenorrhea, that is primary period pain. Then we also have secondary dysmenorrhea, which is secondary period pain. Let me start with primary period pain. With primary period pain or primary dysmenorrhea, it's that type of pain during menses that starts immediately at menarche. What do I mean by menarche? Menarche is like if a young girl starts menstruation, we call that menarche. The first day of menstruation. That is to say, some of you start at 12 years, 11 years, 13, and others delay up to 15 and 16 years. So the day you start menses is called menarche. Now, those girls will start with pain from the word go. So you've been having pains from the word go up to now, probably, then that's called primary dysmenorrhea. Dysmenorrhea or period pain that started as early as the day you started your periods, you started the period pain. That is called primary dysmenorrhea. That one is as a result of hormonal imbalance. It's a result of hormonal fluctuations. So that one is hard to treat, and therefore, because it looks natural. Okay, it looks natural. That's your natural way. Every time you're having periods, there is that interaction of hormones, and you end up with period pain. What we are supposed to do is to get painkillers. There are a lot of painkillers from the lowest up to the highest. So someone has to be given those medicines. Of course, when you use this painkiller and it fails, there is a way we climb the ladder until you get the painkiller that can work for you. Now, that happens to some women, but there is also what they call secondary dysmenorrhea. Secondary dysmenorrhea is that period pain that comes later in life. You started your menses at 12 years, you never had period pain. 20 years, 25, maybe after even delivery, that's when you're having period pain, or later on in life, even if you've not yet delivered. Now, there are pathological causes that bring about that. One, you may be having what they call endometriosis. Women with endometriosis, that is implantation of the endometrium outside the uterus or outside the endometrial lining. Now, I think there is a topic we have on my YouTube channel. It's how to treat endometriosis, how to get pregnant with endometriosis. There are some women who would like to conceive while they are having endometriosis. There is a video, it's there on YouTube. Go and check it, how to get pregnant with endometriosis. It's on my YouTube channel right there. You can check it, you'll understand what endometriosis is. Now, endometriosis is one of the causes of secondary dysmenorrhea. Number 2 can be fibroids. Number 3 can be adenomyosis. Adenomyosis, that is a monster. Adenomyosis is one of the, it causes those severe painful periods. Okay? Severe painful periods, and that also falls under the secondary dysmenorrhea. Now, someone was asking about the treatment, how to do it. Now, treatment will depend on the type. If it's primary dysmenorrhea, just painkillers. If it is secondary dysmenorrhea, treat the cause, because we've already seen that there is endometriosis, there is adenomyosis, and etc. PIDs and etc. So if there is one of those, then you have to treat that cause, and then things will get fine. I hope I've answered you clearly. Let's go to another question. Okay, doctor, can you please make a time slot available to choose from the booking an appointment? I've not gotten your question. Please ask it well. Doctor, can you please, I've not gotten the question. Blessing a bit, is it possible for somebody that have 4 female child to still get a male child? Yes, very, very possible. We've seen women who produce up to 8 children when they are all girls or boys, and then the 9th becomes a different sex. So it is possible. Indeed, how to text I want to get a new. Ndede Nyaicha is saying, how do one increase ovarian reserve after fibroid surgery? I am always very fertile, but after this surgery it's been difficult getting pregnant. Right now, Ndidi Nwaichi, that is not just a one medicine that I will tell you that go and swallow ABC or go and get this injection and you increase your ovarian reserve. Now, after, of course, probably after the surgery, after the fibroid surgery, probably there are a lot of things that were distorted, or there are a lot of changes that happened to your reproductive system too. We also look at what brought about the fibroids, because you know that most people get fibroids because of increased, prolonged exposure to estrogen, to high levels of estrogen. That will lead to people getting what? Fibroids and so on. So for you, if you're failing to conceive, then you have to do a full fertility hormonal profile, a full fertility screening, so that you get to know what is disturbing you. Okay. Then we have another question. It's coming from It is coming from Sandra Amaka. Sandra Amaka is saying, Doc, my teenage is always have her period less than 20 days cycle. Is there an issue with her? I'm truly worried. Yes, you should be worried, because periods less than 20 days, that's abnormal. That's a very short cycle, because the minimum, the lowest should be 21 days. Yes, KP, how are you and where are you calling from?
I'm fine, thank you. How are you, doctor?
I'm good. Be louder and fast.
Yeah, for my worry, come here to appreciate, you're my alumni. We both went to care teaching hospital.
Who is this?
This is Aaron when you see that. Currently, I'm working with Shane Medical Center.
Hey, BMC. Okay, thanks for appreciating. How is the hospital there?
Not bad, we are doing well. We are carrying on very well.
Okay, that's good.
Yeah, thanks for teaching. Thanks so much.
Welcome.
Thank you.
Okay, so we have another question here. It's coming from Takorabi Barbara. Is saying, Doc, is it normal for a person to have periods for 15 days? No, that's not normal. The normal length of periods shouldn't go beyond 8 days. Actually, we usually give a range up to 7 days. So once it goes beyond 7 and then reaches 8, then that becomes abnormal, and we call that prolonged menses. So what you're supposed to do is to go to the hospital. Now you can visit a doctor like this one on our live today on TikTok. You can visit him, and then he does his examinations to find out what is really prolonging your periods. So it's absolutely abnormal to go in for your periods for more than 8 days. Okay, so we have Maxwell Fokwa is saying, Doctor, I wish to ask, does a long stay for a man without sex cause sexual weakness? No. I've heard of those things. I think also what you're forgetting, some people saying that I hear when you take long without having sex, you get back pain. And then someone was trying to explain to me that, doctor, these fluids, the semens, the sperms are at the back. Therefore, when they take long without getting out, you get back pain. That's a misnomer. It's a myth. Fluids, semens, sperms, and so on, they are not manufactured from there, and they don't have even, there is no pipe, there is no connection between the sperms, semens, and the back and the spine, all the vertebra. So the sperms are manufactured from the testes. When you look at your testes, the man is, you call them what? How do you call them? Kesban. Balls. Balls. So sperms are manufactured from your balls. That's where sperms are manufactured from. And then the semens are manufactured from the prostate. And then they have to meet somewhere, because the semens have to transport the sperms. There is no connection between the back, all the spine, all the vertebra, and the sperms. Therefore, taking long without having sex cannot cause back pain. I've also heard women saying, I have back pain because I've taken long without having sex. That is wrong. There is something else causing that back pain. And then someone say, I need fast release fluids. When I release fluids, then the back pain will go. You're lying to yourself. You just want to have sex, not treating the back pain. Okay, we have Becky 11 saying, Doctor, I have high levels of prolactin and I am on bromocriptine for 1 month, but I don't see my periods. I don't know if you've done, Becky 11, I don't know if you've done a full fertility hormonal profile, because the reason as to why you're not seeing your periods may be something else. Maybe you have low levels of progesterone, and actually you know that when prolactin goes high, then there is a way it causes a negative feedback on progesterone, and you end up with hypoprogesteronemia, which can lead to low levels of which can lead to no periods. Okay, doctor, I left family planning. This one is user 5. Okay, doctor, I left family planning 6 months ago, but I am not getting pregnant. Is it okay to use Clomid? No, it is not okay. Who told you that you are lacking Clomid in the body? You've taken long without conceiving, and you want to use Clomid for what? What do you think you are suffering from? This is the problem why people actually end up with complete infertility, because you are using Clomid when you don't know exactly what is bringing the infertility. What you are supposed to do instead is to run what we call a full fertility screening. Identify what the problem is. Now that you've been using those family planning methods, probably they disturbed your hormones, and you right now have hormonal imbalance. So it means you have to first treat that hormonal imbalance. And again, when we say hormonal imbalance, we have many hormones, female hormones. Which one specifically? Is it the progesterone? Is it the prolactin? Is it the estradiol? Which one has a problem? So except if you confirm that the problem is with FSH/LH, then you can take that Clomid. But just taking Clomid will further worsens the infertility. Doctor, how much is the test for fertility? Please, because there are very many tests and not everyone does all those tests. So it's after going to the doctor, you talk to the doctor, they look at which tests to be done, and then you can get to know the prices. And also prices depend each on the country, on the hospital. I will tell you about the price at our hospital, and you'll go to another hospital, it will be very different. I'm in Uganda, the prices may be different from those people in Nigeria and so on. So clearly, I cannot tell you the prices because I may not be sure, but what I can tell you is that you need those tests. Okay, Faith B2 is saying, nimekutafuta sana Doc Uthman. I don't understand Kiswahili, so I don't know. I've just read, I don't know Kiswahili. Please, on my channel, we only use English for the interest of all my viewers. Okay, so there is Sise. Sise is saying, Doctor, I have been on Depo short for only 6 months. How long will it take for me to get pregnant? Depo-Provera sometimes take averagely 3 months. Averagely 3 months you can return to fertility, but there are women who even go up to 6 months. So you can take it to be between 1 month and 6 months. And there are women who just miss by days of taking another shot and they conceive. So it depends from one woman to the other. However, if you've been taking Depo-Provera, those family planning pills, family planning shots, the ones they inject here, the Depo, if you've been taking it and after stopping it, you spend more than 6 months without conceiving, then that's a concern, and you're supposed to do tests to identify what could be disturbing you. Okay, we have Peru is saying, I have one kid now 10 years old. Since then, more, another one. I have one kid, Peru, I have one kid now 10 years old. Since then, more, another one. Really, I've not understood your question. Your English has not Englished enough. Okay. Nelson is saying, hello, doctor. Hello, Sandra. Okay. Okay. Yeah, people are sharing our life. Case back. People are sharing our life seriously. That's very good. Okay, Rio Jules is saying, doctor, does clomiphene cause fibroid to increase in size? No. Clomiphene doesn't cause increase the size of the fibroid. It has nothing to do with the fibroid. So clomid do not implicate it in that issue. Rio Jules is saying, doctor, does clomiphene cause? No, I've already said that it doesn't. Hope is saying, doctor, what causes lower abdominal pain during period time? I've already discussed that. I think it was like the first question I discussed about the secondary amenorrhea and primary dysmenorrhea and secondary dysmenorrhea. I've already discussed about that, but you can go to the YouTube and find out because there is that video on YouTube which is talking about period pain. You go to Ask Dr. UTHUMAN YouTube channel, find that video, it's there. But even here, those people who came, who joined first, I discussed it thoroughly, and it will be repetition if I do discuss it again. User something is saying, can letrozole DENK alone help you to conceive? No. Because you see, I repeat myself. If you are lacking letrozole in the body, then take letrozole. But if you've not done test, letrozole cannot help you to conceive. For example, if you have a man and doesn't have viable sperms, is having low sperm count, and you use letrozole, will you conceive? No. If your tubes are blocked and you use letrozole, will you conceive? No. If you have fibroids, you have masses in the uterus, they are all over in the uterus, they have occupied the whole of the uterus, will you be able to conceive if you use letrozole? No. So the issue is, carry out tests, find out what your body is lacking, find out what the problem is, and then take the medicine. If the problem is low levels of FSH or low levels of LH, then green card, you can use letrozole. Watela Constance is saying, doctor, how much is the cost of testing fertility? I've already answered that. Doctor, does clomiphene cause fibroid? No, I've already said it. Doctor, can you please tell me what could be the problem? Which problem? Which problem? Let me know which problem you're talking about. Doctor, does clomiphene cause fibroid? I've already said it. I think you're asking it several times. D at 07 is saying, hi, doctor. Is it possible to have a regular period and not ovulate? Yes, very, very possible. There are very many women with regular periods, even 28 days, but they are not ovulating. And those women are likely to be having a problem with low levels of luteinizing hormone or low levels of follicle-stimulating hormone. So those two hormones may be problematic. And most times it is the luteinizing hormone and what we call hypoluteinizing here, or low levels of luteinizing hormone. So it's possible. Okay, Chero 007 is saying, is it normal to have ovulation pain for 3 days? Very normal, very, very normal. Sharon Moore at gmail.com is saying, my period always comes back by 2 to 3 days every month. What do you mean? I've not understood the question. And at the end of the year, I have period twice a month. Okay. I think you're likely to be having hormonal imbalance. So you need to do a full fertility hormonal profile to find out which hormone is a culprit there. Okay. We have other questions here, and someone is saying, Florence Wanjiko is saying, Doc, I have a coil and I want to conceive. How many days will it take to conceive? With a coil, or what we call an IUD, you can conceive immediately. You take out the coil, okay? You can conceive because it's a non-hormonal method. So when you remove it, it's a barrier method. The moment you remove the barrier, sperms can enter and cause conception. So as long when you remove it, you can conceive anytime you have periods, especially when you've had, anytime you have your ovulation, especially if you have sex during the ovulation time. Okay, Chia is saying, Dr. Letrozole I take didn't affect my egg size. Because I checked just 16 before tablet, 17 and after taking the tablet. So how can I take letrozole high dose to affect egg size? Is it safe to take 2 times 2? Chia. I want to first understand whether you have low levels of LH.
before I give you my answer. Let me know if you've done a full fertility hormonal profile, and let me know if you have poor luteinizing hormone results. Sandra Amaka is saying, so in that case, what do you advise I do in her case? What kind of test do I do, please? Which Sandra Maka, you see now, when you ask another question in reference to the other, it means you're telling me to go back and check the other question you asked. So it becomes hard. So I don't know what you're referring to. Blessing Ebidi, in marriage that they only have, Blessing Ebidi is saying, in marriage that they only have a female child, no male child, is a cause from the woman or man. Sex determination is done by a man. If a woman is conceiving only girls, the problem is with the man. If a woman is conceiving only boys, the problem is with the man. I have evidence that is 100% proved beyond doubt. Sex determination, and especially in Africa, we have a problem. When a woman is giving birth to girls, the blame will always be on that woman alone. They will not look at the man. But sex determination, the person that determines which gender you're going to give birth to is a man, because scientifically a man has X and Y chromosomes. X and Y chromosomes. A woman has XX chromosomes. X represents a girl child. Now, women have only girls in their womb. All women have only girls in their wombs. It is you, the man, that either brings a dose of a man, and puts it onto if you bring the man dose or the boy dose and add it onto the girl dose, that baby will be a boy. If you bring a baby dose and add it onto the other baby, the other female or the other baby girl for the woman, it will be a woman. It will be a baby girl. Therefore, it's the man. What am I trying to mean? I think let me give you a drawing. Let me give you a drawing to make it easier. Okay? Let me give you a drawing to make it very, very easy. To make it very, very easy. I want you to be very attentive here. This is a man. This is a sperm. Okay? And this is an egg. Okay? Sperm and then egg. I don't know if you're seeing that. Okay. Okay, here. Okay, you're seeing. You're able to see. I know you're seeing there. Okay. This is a sperm, this is an egg. So a sperm is XY. X means girl. I want you to understand this very clearly, because it causes a lot of confusion. You find people fighting the woman. Everyone wants to fight the woman, that the woman is giving birth to only girls. So X represents a girl. Y represents a boy. These are the chromosomes for the sperm. Now we have the egg. The egg contains X and X. X and X. That means this is girl, this is girl. So when a man and a woman meet, they have sex, they will share the chromosomes. Now, if this man brings X, this one, and it meets X, they will form XX. That is a girl child. If this man brings Y, of course the Y will meet the X, and the child will be XY. That means it's a boy. Now, colleagues, with this, who determines the sex? The woman is only giving girls,
And it's the man that decides to either put a girl or a boy. So sex determination is done by a man. Stop stressing your women. That is scientific. There is evidence. There is no doubt. No scientist has gone against that. Sex determination is done by a man. Okay, I hope this is very, very clear. Let me go to some other question here. Okay, Shukran Binti is saying, my breasts are now paining. My last period was on 9th last month, but breasts are paining me, doc. What could be the problem? Sometimes breast pains are as a result of hormonal fluctuations during periods, but sometimes you may be having mastitis. Okay, so you can go to the hospital and get a checkup. You may find that the breasts are sick. So, and that mastitis can bring issues. Okay, so you need to go do the tests and find out what is disturbing you. Mutoni Angelique is saying what? Hi doctor, what medicine will help me to avoid miscarriage? The first time it happened 2 months. Now I want you to help me. Oh, Mutoni, you got a miscarriage. We were here, you told us how you had conceived. Sorry about that. Now, I cannot tell you how to avoid a miscarriage when I don't know what is causing the miscarriage. There are very many causes of miscarriages. For example, we have what we call hormonal imbalance, low levels of progesterone. We have what we call incompetent cervixes. There are also issues to do with rhesus factor incompatibility, when your blood group is not compatible with your man's blood group. So those are some of the factors that can cause that. Now what we need to know is to first find out, Angelique, first do tests. Do tests to find out what the problem is, what is causing the miscarriages. You may find that it is an incompetent cervix that you will need to put a McDonald's stitch. You may find it's you need a McDonald's stitch. You may find that you need progesterone supplements. So there are a lot of things. Jessica Sanyo is saying, my AMH is low and 45 years. My MP stopped 4 months ago. I want to give birth. I said, what can I do? You can give birth. At 45 years, even if you can give birth. What is supposed to be, yes, you've stopped your periods. You can run, you can run a fertility screen. We find out which areas are still okay and which areas are getting abnormal, and then you get treatment. Then you, first of all, you bring back the periods, you resume your periods. After having periods, you can now conceive. So it's possible for you to conceive. 45 years, we've even seen women conceiving at 50, 55, 60. So 45 you can conceive. Nachan's Esther, doc, my sister has 11 male child. She used to take emergency pill, but now he is looking for a child since 2020. What can she do, please, so that she gets pregnant? She has 11 children and she wants to conceive again. All right, it's okay, but let her do fertility screening, like I've been talking about. Special Chera is saying, hi doctor, can the blocked tubes be opened again if it was done by a doctor, but if I want a child again? Yes, they can be opened. They can be opened. They can be opened. User 59 something is saying, doctor, how can PCOS, PCOS or polycystic ovarian syndrome be managed? Been struggling with it for so long. Polycystic ovarian syndrome has medicines. But of course, after a series of tests, we do a series of tests and you can get medicines. There are medicines called PCOS, there's medicine called Rimona, there are times we give those family planning pills, there are times we give hypoglycemic medicines, so there are medicines. So you just go to the hospital, get tested, and then you can get the medicines. Okay. Doctor, okay. Doctor, how long does it take to get pregnant after my periods? It depends on the length of your menstrual cycle. We cannot know when you can conceive except if we know the length of your menstrual cycle. So give us the length of your menstrual cycle. Is it 28 days? Is it 21 days? Is it 30? Then if you give us that number, very easy, we shall calculate it here and tell you when to go and hit the jackpot. Alma Omar 23 saying, how are you, doctor? I am fine. Good evening. I am asking PCOS issues. What are you asking exactly about PCOS? You want me to discuss the whole topic? Okay. How can PCOS be resolved? I've already told you. This question is being over-repeated about clomiphene causing fibroids. I already answered that. But someone keeps on bringing it. Okay, it's okay. Ali AI Sayed is saying, doctor, I have breast tenderness 1 week after my periods and my cycle is 35. Is it normal? Yes, that can be normal. It can be probably maybe you're having your ovulation or you're about to reach your ovulation. So it is normal. It is normal. It's as a result of hormonal fluctuations. Okay, doctor, talk about PCOS. I have failed to conceive. I've already talked about PCOS. Okay. We have other questions here. Someone is saying, is called who here? Okay, Spesh. Hi doc, can block tubes be opened again? Yes, I've said they can be opened. Carbonero is saying, hi doc, what causes a woman to get pregnant after ovulation day? Of course, but there's a limit. But we said that when the ovulation day happens, remember the egg, most time the egg remains live up to actually 24 to 48 days, so someone can still conceive. Yes, they can conceive. Chemutai Claire is saying, doctor, is it normal to stay for 43 days before the next period? No, it is not normal because mine keeps on changing from 30 to 43. That is absolutely abnormal. If you'd like to get in touch with me to have a private chat, a private conversation, please go to my website and it is www. Just go to Google and type in www.druthman.com. You'll book an appointment and you'll be able to talk to me physically. Then there are a lot of questions you ask, but some of those answers are right there on my YouTube channel. So visit my YouTube channel, look for some of the topics I've discussed. You maybe find your question being answered. And also don't forget to subscribe and also press the notification bell to be notified of any important video we upload. Also, I want to remind you, my followers, that you look for a channel called it.next. it.next. It is IT, then there is a dot, then the word next. Look for it. It is talking about information technology and it is being run by the man behind my camera here, Kesbag. So it's being run by my man, my front man is called Kesbag of IT.next. It's very good in IT, information technology, very good via camera installation and so on. Very, very good man. So thank you so much. You've been a very good audience today, but it's always time. Time is always not on our side. I want to sign out today. Those questions, the people, for you who have not been answered, please come next time, same time. We shall be live again from 7 p.m. to 8 p.m. That is 19 hours East African time. On Thursday, every Thursday is when we do our live. For today, we shall stop here because of time. I know there are a lot of questions there, but maybe next time we shall answer them. Thank you so much and have a lovely evening. I sign out.
In the heart of Masaka City. Welcome to Maogola Pharmacy. Your number one pharmacy in Masaka City. Ekibuga kya Ssaabasajja Kabaka. At Maogola Pharmacy, you feel the professional touch by a team of dedicated staffs that serve with empathy, love and care. Find us opposite Umeme offices or call us on 0745 976965 or 0784 986138 for orders and deliveries.